Hello everyone, I am going to be presenting on post-op delirium. So the problem here is that many adults and people of all ages are experiencing post-op delirium. The major problem is with older adults who are experiencing the most percentage of post-op delirium compared to all other ages. So it says here that post-op delirium occurs in 17 to 61% of major surgical procedures, and about half of that is the older adult. So I looked up an article of a study that was conducted in the North United States, and it was done by a Doctors of Nursing program at George Washington University. And the medical center that they were at was an inpatient center in ambulatory care for adult medicine. And the study population was patients that were 70 years of age or older. So what were they studying? This study was how to decrease delirium for the elderly and what nursing interventions that they could do to decrease the incidence and length of post-op delirium. So why was this study conducted? They wanted to figure out a way to decrease the incidence and the length of post-op delirium without using medicine. So what types of, therapeutic activities or distractions or other interventions, what can they implement besides pushing medications to control the delirium? So a couple interventions were carried out, including cognitive stimulating activities. So there's something called a sit kit, and this has been used in hospitals for the elderly who are, combative or going through delirium or acute stages of dementia. So they are provided with, colorings, board games, just distractors. It could be TV or anything that's stimulating them cognitively. Orientation protocol, so that could be, having like a clock right there in their room, a calendar, anything that shows them kind of which day it is and that kind of orients them to where they are, putting the curtain up during the day and turning the lights off at night. Therapeutic activities, that could be, again, board games, or if there's a day center or somewhere in the hospital where there's others that they can interact with, that's usually helpful. Exercises, ambulation, things like that. Routine ADL care, so getting them up in the morning, helping them with brushing their teeth, their hygiene, just keeping them in a routine that can help with getting them used to the daily life, and that helps decrease the delirium. And then sleep protocol, so trying not to interrupt their sleep and not coming in their room so often, maybe performing a cluster care, because, we usually get delirious with lack of sleep. So the results of the study showed a decrease in medication use, overall length of the hospital stay, as well as a decrease in sitter hours and a decreased need for restraints. So the sitter hours, that would be like an assistant, a CNA of some sort, sitting in the room with them 24/7 to make sure that the patient is safe. So the proportion of delirium post-op was higher in the control group at 53% than in the intervention group. And so the intervention group that got the activities and the therapeutic activities, all that, was at 37%. So the intervention patients suffered from fewer complications, such as, the stress ulcers, UTIs, nutritional problems, sleeping issues, and falls. So the PICO question that I have here was that in post-op elderly patients, do non-pharmacologic activity interventions compared to providing standard care result in decreased incidence and duration of delirium? And the answer is yes. By implementing these strategies, there was a significant decreased incidence and duration of post-op delirium in the elderly adult. Thank you.